Wednesday, February 23rd. Our first order of business is call to order. The second is we have approval of the agenda. Now, does anyone have anything to add before we go through the approval process?
No.
Okay. So here we have a motion duly moved by Jamie McGarvey and seconded by Scott Robertson. Be it resolved that the Board of Health agenda dated February 23rd, 2022 be approved. So I'll call the vote. Dean?
Yes.
Thank you. Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy, yes. Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes.
Dan is not with us. He sent his regrets. Marianne?
Yes.
And Tanya? Tanya? I knew she was here.
She said. We may have lost her.
I think we may have lost Tanya. But with that, we have quorum with that anyway, so it is carried. Okay. So again, item number 3 is conflict of interest. And as you know, if there's anything that you feel that you have a conflict of interest with during this meeting, please declare it. Item number 4, approval of the previous minutes of the Board of Health meeting from January 26th. I do have a resolution here that's moved by Mary Ann Stickland and seconded by Stuart Kidd. Be it resolved that the minutes from the Board of Health meeting held on January 26, 2022 be approved as presented. I'm not hearing anyone who wishes has any amendments, so we'll call the vote. Dean?
Yes.
Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy? Yes. Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes.
Marianne?
Yes.
And Tanya? We don't have Tanya back yet. Okay. With that, the motion is carried. Okay, the number 5 item on our agenda is the date of the next meeting, and it's April 27th, 2022. And we've all been commenting here that for the first time, we're seeing sunshine through the window, but in April, we hope we're not seeing the snow out there. So let's wish for that to go by the next April meeting. The time is to be determined and the place is to be determined. We're at item number 6, business arising. There's nothing here formally, but I don't know if anyone else has anything to bring forward. All right, then we'll move on to item number 7, which is the report of the Medical Officer of Health. Dr. Cherko, the floor is yours.
Thank you, Nancy. So you've got the report, and I'll just give you a brief update. As we've been experiencing over the last couple of weeks, all the indices have been in decline, which is great news. And as we all know, the public health restrictions have been loosened, and further next week, even more. So currently in the province, we're seeing a reduced number of cases, although they're not an accurate representation of what's in the community. However, the percent positivity rate is down to between 10 and 11%. Up north, though, our percent positivity in ours in the health unit is a little bit higher than that. And the north is lagging somewhat with all the indices. However, we're still headed in the right direction. Locally, our hospitalizations and ICU admissions do remain low, as we're seeing in the rest of the province. So everything is moving in the right direction. We continue to see a decline in outbreaks within our district and similarly in Ontario. We also are focusing on outbreaks that occur in high-risk settings and helping to manage those with case and contacts, as well as ensuring that we continue with our immunization plan. We have shifted. Obviously, there has been a reduced number of people being immunized. However, recently there has been an opening up for 12 to 17-year-olds for third doses, and we haven't gotten a report yet as to the uptake. There are plenty of spots available, and we're also taking walk-ins. We're providing all vaccines in all of the clinics. We're also targeting our approach to outreach to the most vulnerable populations with health equity clinics in those that are hard to reach. We're engaging with our primary care, as well as pharmacies and EMS and any organizations to help reach those that we haven't been able to reach. We're working with school boards as well and doing clinics within the schools and certainly promoting 5 to 11-year-olds, their vaccinations as well. We also know that a more vulnerable population is those that are immunocompromised or don't have a healthy immune system for whatever reason. There are many reasons for that, and certainly reaching out to ensure that they have accessibility to either their first, second, or booster doses, or whatever dose that they may require. So we will be continuing with immunizations, and we're looking at, once the snow clears, to again get our bus mobilized to further our outreach into communities. And certainly we're very grateful for the City of North Bay and their cooperation and help to make that happen, and also to all of the people that have been involved with our immunization clinics, from immunizers to volunteers to municipalities. It really takes a team to ensure that we can get everybody that wants to be immunized. So we're continuing those efforts. We will be starting to have some degree of recovery, meaning that internally, some of the staff that have been redeployed to immunizations will move back towards their regular work. There will be a lot of it'll take a long time to clear the backlog of work that needs to be done, but that's anticipated, and we do have a recovery plan, and we will slowly implement it. But we also have to be flexible depending on whether or not things change and any potential issues with further variants. But right now, everything is in a very positive direction. So I'll leave it at that and open up to anybody that might have any questions.
Any questions from anyone on the board?
Stuart here, if I can ask one.
Yeah, I see Stuart, your hand up. Yeah.
Do you want to say anything?
Thanks. Dr. Chirico, just, and you've maybe touched on this through the last however long, and I may be forgetting, but during the course of this long extended event, maybe you've got a bit more time now, but do the staff put thoughts into a pot for future planning, strategic approach to some other similar emergency like this so that you can plan for it? I guess you probably got that.
Yes, we certainly will be having a debrief, and we will be strategizing on first of all, we need to maintain what we're doing with case and contact management in the high-risk settings, as well as continuing to do immunizations. Then the next phase is certainly going to be the recovery phase, as I mentioned. There will be a review locally as well as provincially, certainly on lessons learned, capacity, what we need to do better, what worked well as planning for the future. And I think that has to occur certainly locally as well as provincially. There is certainly funding available for recovery to try and get the backlog dealt with. We will continue to maintain the personnel that we currently have to help with our permanent staff to get the backlog cleared up and do all the work that's necessary. So we're not out of it yet, and we aren't at a point where we will be strategizing for the next pandemic just yet, but certainly it will be down the road. I hope that answers your question, Stuart.
Yes, it does. Thank you.
Tanya, I see your hand up there too.
Thank you very much. And I apologize, my computer died as soon as I started the meeting. So if you've said any of this stuff, I can always follow up after. But my first question is with the rat tests. Are we hearing if people are being able to access them readily now, like after the first kind of like that waiver that came in, everyone was kind of going from pharmacy to pharmacy to pick them up? Is it hard to get them right now?
I don't know. I don't have an answer to that.
Okay.
I haven't checked with the pharmacies. Perhaps Dr. Zimblady have anything to?
I don't have up-to-date information on this. I know after they were first made available in local pharmacies and grocery stores, I think the supplies were depleted pretty quickly. But I don't know with further distributions whether the demand now has been satiated somewhat so that there isn't quite that supply issue at this point.
Okay. And then the other question I had was with the reporting, I know we're not checking a lot, but with the hospitalizations, do we track like the number of children? Because I see it sometimes on the larger scale reports or in some health units. I'm just curious how many children are being, I guess, hospitalized.
Yeah.
We do collect information on a daily basis regarding the hospitalizations among the residents in our health unit district, and that there's a template that collects that we populate with information about these patients, and obviously age is one of those data points that we collect, as well as any comorbidities, that sort of thing. So as far as I recall, we haven't had any recent hospitalizations for in terms of due to COVID. There have, I believe, been some potential hospitalizations with COVID.
Yeah, the number of children, not just, locally it's very, very low when we have had any hospitalizations or ICU admissions. It has been extremely low. Similarly, in the province, those numbers are low as well. The highest risk in the children age group would be the ones that aren't vaccinated, less than 5 years of age, because there isn't a vaccine available yet, and we don't have a clear sight line on when that might be available. But we'd be looking at sometime, I would think, after April, if available. But the numbers in the children for hospitalization, severe illness is quite low. And we also know that the vaccines remain very, very effective. And this is to prevent severe disease, hospitalizations, ICU admissions, and deaths. So they still are very effective for that. And we really encourage people that are due for a vaccination or haven't been vaccinated to still, keep that in mind and to be vaccinated. It's the best protection that we have.
Perfect. Thank you very much.
I don't see any other hands up there, but are there any other questions from anyone? You seeing none? Thank you very much, Dr. Cherko. Now we have 8 is board committee report. I'm trying to remember what that is. So we don't have one. That's why I thought, I kind of looked at that for a second. Thank you. Correspondence, it's listed in your package. And then we're on to 10, new business. The year-end medical officer of health expense report, and it is in your package as well. Is there any questions?
Sure. I just, I was kind of curious, and maybe I don't think the correspondence I don't think normally is in our package, but there was just the one where it talked about the one-time funding, I think it was, from the ministry.
Did you have a specific question about it?
Well, I was just curious, like, because we don't see it, I think we have to ask for it, right? So I was just curious, I'm like, is it anything that is surprising? Is it what we knew about?
Yeah, it was what you knew about. It was
Okay.
In the budget, but if you.
Okay. No, that's all I was just, I thought hopefully
Yeah.
maybe they gave us more one-time funding.
No.
Okay, any other questions before we move on to the appointment of the auditor? Oh,
Can I just mention
Yeah.
something? Sorry, Nancy.
Yes,
I just
of course.
remember something. We just found out, actually, just in the last day or two, about the nurses being extended to the end of 2022. So that's very welcome news
That's
for that.
that's the additional staffing that you've required. Is that what
This
you mean?
is the school focus.
School focus
School,
nurses,
the school
yeah.
one, okay, the school nurses, all right. Okay, 10.2 is our appointment of our auditor, and there's quite a lengthy resolution here that's moved by Gary and seconded by Jamie, whereas the Municipal Act of 29610 states, if a local board is a local board of more than one municipality, only the auditor of the municipality that is responsible for the largest share of the expenses of the local board in the year is required to audit the local board that year. And whereas Board of Health Policy BG 007, appointment, recognition, term, or duties of auditors and legal advisors for the Board of Health, Section 4.1.1, states in accordance with the Municipal Act, the Board of Health recognizes the audit firm used by the Corporation of the City of North Bay. Employees of the audit firm cannot serve as members of the Board of Health or be directly related to senior management or financial service employees of the health unit. And whereas the City of North Bay facilitated a request for proposal on behalf of the city and its agencies, board and commissions for audit services for the next 5 years, and that KPMG LLP, Chartered Professional Accountants, was a successful proponent. Now therefore be it resolved that the Board of Health for the North Bay Parry Sound District Health Unit accept KPMG LLP as a health unit auditor for the fiscal year ends from December 31st, 2021 to December 31st, 2025. Are there any questions or discussion on that before we move forward? Okay, all of those in favor, I'll just call the vote. Dean?
In favor.
Dave?
In favor.
Claire?
Yes.
Gary?
Yes.
Nancy, yes. Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes.
Jan is not with us today. Mary Ann?
Yes.
And Tanya?
Yes.
Okay, thank you. With that, carried. At this point, we have 11.0, we have an in-camera session. So I'm just going to, we have a resolution duly moved by Scott Robertson and seconded by Mary Ann Stickland. Be it resolved that the board at 5:21 p.m. to discuss agenda item number 11.1, personal matter, identifiable individual. I will call the vote on that. Dean?
Yes.
Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy? Yes. Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes.
Marianne?
Yes.
And Tanya?
Yes.
And with that, the motion is carried. All right, so we have a resolution here, duly moved by Stuart Kidd and seconded by Gary Gunter. Be it resolved that the Board of Health rise and report at 5:27 p.m. I'm going to call the vote. Dean,
Yes.
Dave,
Yes.
Blair,
Yes.
Gary,
Yes.
Nancy, yes. Stuart,
Yes.
Jamie,
Yes.
Scott,
Yes.
Marianne,
Yes.
and Tanya.
Yes.
And with that, the motion is carried. We have a second resolution here, and it's moved by Jamie McGarvey, and it's seconded by Scott Robertson. Whereas the Board of Health approved the addition of an Associate Medical Officer of Health position for the North Bay Parry Sound District Health Unit in brackets, as part of the 2022 budget proposal at the January 26, 2022 Board of Health meeting. And the motion is listed there as Board of Health 2022-0109. Now, therefore, be it resolved, the Board of Health for the North Bay Parry Sound District Health Unit approves the appointment of Dr. Carol Zimbalati as the Associate Medical Officer of Health for the North Bay Parry Sound District Health Unit, pending approval of appointment by the Minister of Health and pending acceptance of the position by Dr. Carol Zimbalati. Now, with that, if there's no discussion, I'll call the vote. Dean,
Yes.
Dave,
Yep.
Blair,
Yes.
Gary,
Yes.
Nancy? Oh, yes, I do it again. Stuart?
Yes.
Did that again. Oh, my gosh. Jamie?
Yes.
Scott?
Yes.
Marianne?
Yes.
And Tanya?
Yes.
With that, it's carried. Okay. Now, there doesn't seem to be anything else on our agenda. So, which is kind of a good thing, short and sweet, to the point. So with that, we have 12, which is our last point, is our adjournment. So I just wish that everybody has a good evening, and thank you for attending the meeting. And we'll see you in April. Stay safe.
Stay safe,
Bye.
everyone.
Thank you.
Bye.
Bye now.
Take care.